this. Again, we don't want everybody taking this test. It's totally unnecessary. And this will pass. This will pass through, and we're going to be even stronger for it. We've learned a lot. Tremendous amount has been learned. I want to thank Deborah Birx, and I want to ask her maybe to come up and say a few words as to what's happening. Dr. Birx is a highly respected person I've gotten to know very well over the last 6 days. And what we've done is we built something that was very old-fashioned, somewhat obsolete, certainly obsolete when it comes to the kind of numbers that we're talking about. Dr. Birx, please. Thank you, Deborah.
Thank you, Mr. President. It's a pleasure to be here with all of you. I think you know at the beginning of this epidemic, HHS through CDC proactively developed an assay built on the existing flu surveillance system. That surveillance system was then converted to diagnostic system. But last Tuesday, seeing the spread of the virus around the globe, the President realized that our current approach to testing was inadequate to meet the needs of the American public. He asked for an entire overhaul of the testing approach. He immediately called the private sector laboratories to the White House, as noted, and charged them with developing a high-throughput quality platform that can meet the needs of the American public. We are grateful to LabCorp and Quest for taking up the charge immediately after the meeting, and within 72 hours bringing additional testing access, particularly to the outbreak areas of Washington State and California, and now across the country. We are also very grateful to the universities and large hospital systems that took up the charge to develop their own quality tests, made available by new FDA guidance. This has resulted in expanded testing across New York, California, Washington, Colorado, and you see sometimes those drive-through options that have been made available through these high-throughput options. Following the meeting last week, major commercial laboratory equipment and diagnostic companies took immediate action to adopt and develop new testing systems. Last night, the initial company, Roche, received FDA approval, moving from request to development to approval in record time. This innovative approach centered fully on unleashing the power of the private sector, focusing on providing convenient testing to hundreds of thousands of Americans within short turnaround times. In less than 2 weeks together, we have developed a solution that we believe will meet the future testing needs of Americans. I understand how difficult this has been. I was part of the HIV/AIDS response in the 80s. We knew from first finding cases in 1981, it took us to almost 1985 to have a test. It took us another 11 years to have effective therapy. It is because of the lessons learned from that we were able to mobilize and bring those individuals that were key to the HIV response to this response. And I understand that a lot of this behind-the-scenes action over the last couple of weeks was invisible to the press and the American people. But this intense effort has not only resulted in innovative solutions, but an automated, high-throughput system bringing the availability of these quality coronavirus testing to the American people at unprecedented speed. Finally, I want you to know in South Korea, they did have a large number of tests available over the last several weeks. Their positivity rate is between 3% and 4%. With LabCorp and Quest expanded testing, their positivity rate is between 1% and 2%. So we want to also announce this new approach to testing, which will start in the screening website up here, facilitated by Google, where clients and patients and people of interest can go, fill out a screening questionnaire, move down for symptoms or risk factors, yes. They would move down this and be told where the drive-through options would be for them to receive this test. The labs will then move to the high-throughput automated machines to be able to provide results in 24 to 36 hours. That is the intent of this approach. We have seen it work just in our own United States, and we want to bring this across the continent. Thank you very much.
Thank you very much. I'd like to maybe have Tony, do you want to come up? You become I think everybody out here knows you pretty well, but Tony has been doing a tremendous job working long hours, and you've seen a lot happen, but this has been, it's been a great experience, and working with you has been terrific. Tony, please.
Thank you very much, Mr. President. This is an example of, another example of what I've been referring to in my discussions with many of you in the audience as a proactive, leaning forward, aggressive, trying to stay ahead of the curve. And what you're seeing now with this order is that we're going to be able to remove the constraints so that people at the state, the local level, the individual physician, all the way up through the federal government will have as many constraints as possible removed for them to do everything they possibly can so that we can implement the things that we've been talking about. The containment, the mitigation, so that, as I've said many times, that curve that I refer to that goes up, we don't want to have that curve. We want to suppress it down to that small mound. And I think what we've done today is something that is going to be a very important element in having us be successful in doing that. We still have a long way to go. There will be many more cases, but we'll take care of that. And ultimately, as the President said, this will end. But what's going on here today is going to help it to end sooner than it would have. Thank you.
Thank you very much, Tony. If I could, some of these folks we know, they're celebrities in their own right. They're the biggest business people, the greatest retailers anywhere in the world, and one of them is Doug McMillon from Walmart. And I'd like to have Doug, if you would, say a few words, wherever you may be. Good, please.
When we got the call yesterday from the White House, we were eager to do our part to help serve the country. And given what we're facing, that's certainly important to do. We should all be doing that. So we've been asked to make portions of our parking lot available in select locations in the beginning and scaling over time as supply increases so that people can experience the drive-through experience that the President described. We'll stay involved and do everything we can from a supply chain point of view to be of assistance. Thank you, sir.
Thank you very much, Doug. Appreciate it very much. I'll just stay right over here. And Richard, if you could come up, please. Richard, please. Walgreens, thank you.
Yeah, thank you, Mr. President. And similar to Doug and Walmart, we're happy to stand in here and help in communities all across America, because a lot of times when we have natural disasters, our stores are a beacon in the community, and this situation is no different. So we look forward to partnering with the CDC, the administration, HHS, and the task force, and specifically to the Vice President's doing such a fantastic job. We're ready to engage and help. Thank you.
Thank you very much. Great job. Thank you very much. Brian Cornell, Target. Thank you, Brian. Thank you, please.
Well, Mr. President, thank you for inviting us here today, along with our colleagues from Walmart and Walgreens and our partners at CVS. Normally, you view us as competitors, but today we're focused on a common competitor, and that's defeating the spread of the coronavirus. And we look forward to working with the administration to do our fair share to alleviate this growing threat. So thank you for including us today. In the near term, we're all committed to making sure we're keeping our stores open to serve the American consumer who's rapidly stocking up on household essentials, key food and beverage items that they need during this time, making sure we run safe stores and create an environment that's safe for our team members, with making sure that they feel supported during this very critical time. So thank you for including us.
Thank you very much. Great job. Is Tom here? Tom Bowl? Tom Bowl, please.
Thank you, Mr. President. As CEO of Becton Dickinson, we're one of the leading providers of medical devices as well as collection products for testing of coronavirus. We're ramping up our manufacturing capacity to ensure that the right collection devices and testing equipment are ready to address this issue. Thank you, Mr.
Thank you
President.
very much, Tom. Great job you've done. Stephen Rakowski, Quest Diagnostics, please. Great job. Thank you.
Thank you very much. Thank you, Mr. President. So as mentioned, we were called with the leadership of the Vice President last